Hi all, welcome back to our Allied Lecdem channel. In this video, we are gonna see about the anatomy of clavicle. As we all know, out of 206 total bones in man, the upper limb consists of 64, each side consisting of 32 bones. It has been divided into shoulder girdle and free part limb. The shoulder girdle consists of clavicle and scapula, whereas the free part limb has humerus, radius, ulna, carpal, metacarpal, and phalanges. As we could see in detail, it is being divided or it is being named as shoulder region consisting clavicle and scapula. Next is upper arm, that is from your shoulder to the elbow, making humerus bone. Next is forearm, that is from elbow to the wrist, consisting of radius and ulnar bone. Last is hand. It is being subdivided into wrist is made up of carpus and hand of metacarpus, and the 5 digit is made up of phalangeus bone. Now we'll see what is clavicle. Clavicle is nothing but a long bone and is also known as collarbone. A clavicle is a slender S-shaped long bone of 6 inches long, and it supports the arm so that the arm can swing clearly away from the tongue. And the bone has a cylindrical part known as shaft and two ends, namely lateral and medial end. The clavicle transmits the weight of the limb to the sternum. Next, we'll see the functions of clavicle. It provides the maximum range of movement by it supports a rigid from which the scapula and free limb are suspended, an arrangement that keeps the upper limb away from the thorax so that the arm has a maximum range of movement. Acting as flexible crane-like strut, it allows the scapula to move freely on the thoracic wall. Next is the covering the cervico-axillary canal, and it protects the neurovascular bundle that supplies the upper limb and transmit physical impacts from the upper limb to the axial skeleton. Next, what are the peculiarities of clavicle? That is how this bone is being differentiated from the other bones in our body. First is it is the only long bone that lies horizontally. That is, clavicle is a bone that lies horizontally and it's a long bone. It is subcutaneous throughout and is the first bone to start ossifying. Ossifying is nothing but a bone formation. Next, it is the only long bone which ossifies in membrane and is the only long bone which has two primary centers for ossification, and there is no medullary cavity. And the blood supply of the clavicle bone is from suprascapular artery. Next is the side determination of our clavicle bone. The first is the lateral end. The lateral end is flat and the medial end is large and quadrilateral. As we could see in this image, the medial end is often quadrilateral in shape, and the center part of the bone is named as shaft and slightly curved. Now we'll know why clavicle bone is named S-shaped. Because of the shaft is slightly curved, it is being named as S-shaped bone so that its convex is forward in its medial 2/3 and concave forward in lateral 1/3 of the portion. Inferior surface is grooved longitudinally in its middle of 1/3. So, in lateral surface, we could see the surface for articulation with acromion, that is acromion process of the humerus, whereas in medial end, it articulates with the manubrium of the sternum. And in this we could see conoid tubercle and trapezoid line, about which we'll see in the further slides. Next are some of the features of the clavicle. It consisting shaft, lateral and medial ends and its attachment. First and foremost is shaft. Shaft is being divided into medial 2/3 and lateral 1/3. The medial part is thicker than that of the lateral, and the lateral part is The lateral one-third of the shaft is flattened from above downwards and it has two borders, namely anterior and posterior. Anterior is concave forward, whereas posterior is convex backward, and it has two surfaces, namely superior and inferior. Superior is subcutaneous, whereas the inferior has an elevation called conoid tubercle and ridge called trapezoid ridge. And the medial two-third. In medial side, we could see it is rounded and it has four surfaces, namely anterior surface is convex forward, whereas the posterior is smooth and superior is rough, and inferior has a rough oval impression at the medial end. So in this image we could see the centermost part of a bone is named as shaft, and which is articulating with the acromion process is known as acromio-clavicular joint, whereas towards the sternum it is known as sternoclavicular joint. And in shaft we should remember in the lateral end the superior surface is subcutaneous, whereas the inferior surface has elevations like conoid tubercle and ridge called trapezoid ridge. Next is the medial end. Medial end is also known as sternal end because it articulates with the clavicular notch of the manubrium of the sternum to form sternoclavicular joint. And this articular surface extends to the inferior aspect for articulation with the first costal cartilage. Next is lateral end. The lateral end is also known as acromial end. It is a flat from above downward. It bears a facet that articulates with the shoulder to form acromio-clavicular joint. The area surrounding the joint gives an attachment to the joint capsule, and the anterior border is concave forward and posterior is convex. As we saw, it also has an attachment, namely conoid tubercle and trapezoid line. Conoid tubercle, it is attachment point of the conoid ligament and is a medial part of the choroclavicular ligament, and trapezoid line is attachment point to the trapezoid ligament and it is the lateral part of the choroclavicular ligament. So these two projections are important and aiding for the attachment of the conoid and trapezoid ligament respectively. So as we could see in this image, there is convex posteriorly and concave anteriorly, and conoid tubercle where there is attachment for the conoid ligament, whereas trapezoid line is attachment for the trapezoid ligament. So it is present in the lateral part of the choroclavicular ligament, whereas conoid is to the medial part. Next, we'll see the attachments of the muscle to the clavicle bone. In superior surface, we could notice deltoid muscles and other attachment like deltoid tubercle, whereas in superior surface the other muscle is trapezius muscle, whereas in inferior we could see the attachment of subclavius muscle, conoid ligaments and trapezoid ligaments, whereas in anterior border pectoralis major muscle, whereas in posterior borders sternocleidomastoid muscle, sternohyoid muscle and trapezius muscles. So importantly, what are the muscles of attachment to seen in clavicle bone are in anterior pectoralis major, which has been marked as red in color in this image, and in posterior border is sternocleidomastoid muscle marked as green in color. So these are the important muscles which has been attached to the clavicle. Anterior border is pectoralis major, which has been marked red in color, whereas in posterior border sternocleidomastoid muscles, that is yellow in color, whereas in superior surface we could see deltoid muscles and trapezius, that is blue and green in color, whereas in inferior surface we could see subclavius. Next is coracoclavicular ligament. As we saw, it connects the clavicle to the coracoid process of the scapula, and two ligaments are trapezoid and conoid ligament. Next is radiographic features of the clavicle bone. On chest x-ray, the clavicles are superimposed over the apex of both the lungs and obscure the subtle lesions. An apical or lordotic view may then provide a greater detail in lung apices. So, chest x-rays are correctly aligned in the medial ends of the clavicles are equidistant from the spinous process of vertebra at the T4 or T5 level. Next are the clinical anatomy relevant to clavicle bone. The first and the most important and most widely seen is clavicular fracture. It is the weakest part of clavicle is the junction of lateral 1/3 and medial 2/3 and is the most common site of fracture. And other conditions like acromioclavicular joint injury, sternoclavicular joint dislocation, clavicle tumor, sclerotic clavicle, pediatric clavicle abnormalities, osteolysis, and distal clavicular erosion. After clavicular fracture, the most common problems arises in clavicle are sternoclavicular joint dislocation. Next, we have come to an end of an video. We'll just brush up what we have been seen through this video. First, clavicle is a long S-shaped bone, so which helps the arm can swing clearly away from the tongue and it transmits the weight of the limb to the sternum. The side determinations, we should be knowing that lateral end is flat whereas the medial end is large and quadrilateral in shape, and it is the only large bone that lies in horizontal way. And shaft, we know the shaft has been divisible into lateral 1/3 and medial 2/3. The next we have seen about lateral ends and medial ends. We know lateral ends are also known as acromial end, which is flattened from above downwards, whereas medial end is also known as sternal head. It is in quadrangular and articulates with the clavicular notch of the manubrium sternum, and attachments like in anterior surface, posterior, having sternocleidomyostoid muscles, trapezius, and so on. Next, in clinical anatomy, we saw clavicular fracture is the most commonly seen condition related to clavicle. I hope you all understood this topic. Thank you.